This is Dr. Stewart with Timonium Foot and Ankle Center. Good morning. We're showing another case of Radiesse dermal filler. I have a nice doctor with me today, Dr. Z. Dr. Z has been a patient of mine for a while, and if you come over here on his foot, you can see he's got, it's hard to see maybe in the video, there's a little bit of callus here, but I am touching his bone, and that I'm trying to be gentle. This hurts. Doc, you came to me several years ago. You had pretty painful calluses. We made you some orthotics, and you did reasonably well with that, correct?
Right, very well.
Okay, but you continued to have pain, and we did these dermal fillers on him a year ago. So the Radiesse dermal fillers can last as minimum of 6 months, and they can last up to 18 months to 2 years, some cases 3 years. I would say average, we're seeing about 18 months. Some cases we've had where it's a year. Regardless, tell us how you did with the dermal fillers. How would you say it helped you?
Immediate relief and permanent relief for
a year. Okay, and we're going to do it again because you're happy with the treatment.
Very happy with
okay,
it.
so he has a very bony foot, and as a result, he gets a lot of pain when he walks. And when I saw him last, he was doing reasonably well, but he's had a fairly increased pain. We've numbed this area up already, and what we're going to do is just inject the area with the dermal filler. If you have any pain, you tell me. And his main area is right here beneath the fourth metatarsal phalangeal joint. So we're going to just start by going in, a little pinch, and we're going to just gently inject the area, and we're going to push it through. And I'm just going to put my finger here to make sure I feel where we're going so I can make sure we're plumping up this area. Any pain?
No.
Good. He's doing great. Okay, we're going to come here. Make sure we get this area nice and good. Coming around, okay? I'm gonna move my needle a little bit. I'm gonna come over a little more medially. We're gonna get a drop of bleeding there, that's okay. We're gonna get another pinch, sorry doc. And he's done extremely well. He'll of course continue with his orthotics, but this has been a really big improvement because prior to this, he was really limping around. He was in a lot of pain.
I was splitting because of it.
Yeah. He was in a lot of pain. He was limping around, and it aggravated other parts of his body. So, you know, it just goes to show how simply treating the feet can make a big difference. Of course, we're going to put a little aperture pad around this area, and you can really see this area. If I put my finger here, it's full. You can really feel the injection. That's why I like this, because you can feel this right away. And, you know, the risk is very minimal. We've prepped this area with some rubbing alcohol. You know, we're trying to avoid surgery here. Surgery has a long recovery. There are big risks with surgery. And of course, if surgery needs to be done, we will do it. But, you know, we're trying to avoid it. So we're going to put a dressing on him. We'll check back with him in a few weeks. This is Dr. Stewart from Timonium Foot and Ankle Center. Have a great day.